Hi, I'm Dr. Dante Gonzalez, and I'm a practicing orthodontist. I've almost been in practice for 20 years, and I'm also a Sharecare Advisory Board member. And I'm here today to talk to you about healthy foods for your teeth and not so healthy foods for your teeth. The first thing you want to remember is that most of the foods that are healthy for your body are usually healthy for your teeth also. Foods like fruits and vegetables, things that you hear about all the time that are healthy for your body are also healthy for your teeth. Things that are leafy and green, vegetables. One of the reasons why is because they're high in vitamin C, and they're also high in fiber, and they're also high in calcium. So those three things not only help your body, but they also help your teeth. The vitamin C and the calcium help keep your teeth mineralized and strong. And the fiber has like a cleansing mechanism where it helps clean the teeth of bacteria and plaque as you chew on the vegetables and the fruit. Now, some fruits are very acidic, which is okay as long as you eat them in moderation. And also make sure you rinse out all the acid after you eat them. Things like lemons, grapefruit can be very acidic, so you want to be careful with those. But there are a lot of other fruits that are high in vitamin C that aren't as acidic. Things like oranges and pears and things like that. Foods like cheese and yogurt, they're also high in calcium and phosphates, and those also help protect your teeth while also strengthening your teeth. The calcium helps strengthen the teeth with minerals, as do the phosphates, and they also help reduce bacteria levels in your mouth. Some yogurts are high in sugar, so you want to be careful with those. Just like with your body, you don't want to eat a lot of sugar, especially refined sugar, refined flour. Things that are bad for your body are also going to be bad for your teeth. That refined sugar, the bacteria can use readily to increase the plaque levels and increase the acid levels in your mouth, which cause decay, they cause gingivitis, and ultimately they can also cause periodontal disease, and you could have tooth loss. There's other foods like garlic and onions, which are healthy for your teeth. They have sulfur compounds in there that help inhibit bacteria levels. But the downside is they get into your gut, they get into your blood, and then they come out, the sulfur compounds come out in your breath, not smelling so good. So you want to be careful with that. If you do have bad breath from garlic or onions, some of the things you can do is rinse your mouth out with water. Water is one of the healthiest things you could drink. You want to keep your mouth very hydrated, and water is the best thing to do that with. You could also eat things like mint and parsley, which do the same thing as the garlic and onions. They go into your gut, they go into your blood, and they come out, they have these things called monoterpenes that come out and they make your breath smell better. There's also things you could drink that are very healthy for you, like green tea. Green tea has catechins in it, and the catechins help reduce bacteria levels. They also help reduce the osteoclast activity, which the osteoclasts are the things that start to break down your bone when you have periodontal disease. So in a way, it can sort of slow down periodontal disease if you drink green tea. Also, the catechins, they're also good for your body. They're kind of an antioxidant and anti-cancer agent. So green tea is also good. Milk is also good in moderation. It has a lot of calcium and vitamin D, which is good for your bones and your teeth. So you can also drink milk. You just also want to make sure that you're brushing afterwards. You don't want to let the milk sit in your mouth. Things you want to avoid are obvious things that are high in sugar. Soda is probably one of the worst things you could drink. It's also bad for your body, but it's high in sugar and it's high in carbonic acid, both of which are bad for your teeth. They increase bacterial levels. It's very acidic, so it's hard on your teeth and your gums. So you want to avoid those. You can drink coffee. Coffee is not necessarily bad for you. However, if you put a lot of sugar in your coffee, again, it's the sugar that's bad for your teeth. And one of the worst things you could do is drink sugary coffee over a long period of time. If you're drinking any sugary drink, you want to drink it in a very short amount of time and then rinse your mouth out or brush your teeth to get all that sugar out. You don't want to give the bacteria a long, constant flow of sugar into the mouth. And I know there are a lot of people out there, they drink sugary coffee and they sip on it all morning. It may take them 3 hours to finish a cup. That's one of the worst things you can do. Red wine is not necessarily bad for your teeth, but it can stain your teeth. So things like red wine, coffee, even tea, although tea is good for you, it can stain your teeth. So if you want to avoid that, what you can do is drink your coffee or red wine or tea through a straw, which prevents the teeth from getting bathed in the red wine or the coffee. If you don't want to use a straw, you could always brush your teeth afterwards. You could always whiten your teeth. You could do that in moderation. And you could also use whitening toothpaste. Although you want to be careful with whitening toothpaste because they are very abrasive. And they can, if you use it too much, they can abrade your gums and your teeth. There's also some mushrooms, like shiitake mushrooms. They have these things called lentinins in it, which also help prevent bacterial accumulation. They help inhibit bacterial growth. And wasabi. Wasabi, for any of the sushi eaters out there, wasabi has these things called isothiocyanates, which also inhibit bacterial growth. And so there's a lot of foods out there that help with keeping bacterial levels low. But the main thing you want to remember is to brush and floss and drink lots of water. When you brush and floss, you instantly reduce the bacterial levels. And when you're drinking lots of water, you're helping increase saliva flow. And saliva flow, believe it or not, is your #1 protectant of your teeth against cavities, gingivitis, bad breath, periodontal disease. So the more saliva flow you have, the healthier your mouth is going to be. So you want to make sure you're very well hydrated and brush and floss. I hope that was informative. So until the next Facebook Live, make sure you're brushing and flossing and drink lots of water.